Number 1 on our list is Finasteride. Now, for men, the most effective FDA-approved treatment for thinning hair and balding is Finasteride. Finasteride, is also known as its brand name Propecia and Proscar, works by lowering the body's levels of DHT, which is the main cause of hair loss in both men and women. Now, clinical trials have shown that Finasteride can reduce and even stop the progression of hair loss in 86% of men. While side effects from Finasteride are rare, there's about 5% of men treated with Finasteride that reportedly have sexual side effects such as erectile dysfunction, decreased libido, and ejaculation disorder. Number 2 on our list is Dutasteride. It's also commonly known as Avodart. And like Finasteride, Dutasteride works by blocking the body's levels of DHT. However, clinical studies show that Dutasteride reduces serum DHT significantly more than it does with Finasteride. A study was done on male subjects who received doses of Finasteride and Dutasteride, and the study showed that Finasteride decreased the serum DHT by about 70%, while Dutasteride decreased serum DHT by more than 90%. Some hair doctors and dermatologists are not going to prescribe Dutasteride because it is not FDA approved for hair loss, and some of the side effects are more common than Finasteride and can include similar sexual side effects. Now, one of the best hair loss treatments available on the market is a hair transplant. The hair transplant is one of the best permanent hair loss treatments available, but it's also the most priciest. Now, as most of you guys know, I had a 1700 graft FUE hair transplant back in November to rebuild my frontal hairline. There's 2 different hair transplant methods. One is the follicular unit transplant, known as the FUT, and the other one is the follicular unit extraction, that's the FUE. Now, I opted for the FUE so that I wouldn't have a linear scar on the back of my scalp. If you want to find a good hair transplant doctor, make sure you guys do the right research, ask the right questions, and you can even visit hair transplant forums such as hairrestorationnetwork.com or hairlosstalk.com. And there's a lot of people that review different doctors. You can see before and after pictures so that you guys can choose the right hair transplant doctor for you in your area. Next up on the list is Minoxidil. It's also known as Rogaine. Rogaine is actually another great FDA-approved hair loss treatment. While it isn't as potent as Finasteride or Dutasteride, it can help promote hair growth in both women and males suffering from androgenic alopecia. Now, Minoxidil needs to be used indefinitely for continued support of existing hair follicles. Some of the side effects can include burning of the eyes or eye irritation, redness on the treated areas, or even allergic reactions. Now, the theory behind Minoxidil is that it widens blood vessels and opens potassium channels, which eventually allows more oxygen, blood, and nutrients to the hair follicles. A good thing about Minoxidil is that it can be obtained over the counter without any prescription. Next up on our list is Scalp micropigmentation. It's another fairly new hair loss treatment. It's also commonly known as medical hairline tattoo, which is a series of tiny pigments that resemble hairs that are tattooed in between existing hairs to create an illusion of more density. Now, it can be used for people who don't have enough donor hair for a hair transplant. It can be used to cover up areas of the scalp that are due to thinning, scarring, or other scalp diseases. The scalp micropigmentation can cost anywhere from $2,000 to $5,000 and upwards. It just depends on the severity of the hair loss. Now, the best results are seen when the head is kept shaved. Another good thing is that there's no side effects, unlike prescription drugs such as Finasteride and Dutasteride. And the average scalp micropigmentation patient requires a touch-up every 3 to 6 years. There's special needles that are used to secure the pigmentation closer to the skin surface so that most patients don't have to worry about discoloration. Last but not least, we have the platelet-rich plasma, also known as the PRP therapy. It's another hair loss treatment used by many people suffering from baldness. A person can use his or her own platelet-rich plasma, which is then injected into the scalp. The blood plasma contains active growth factors, which can promote hair growth, thicken thinning hair, and increase the overall health of the scalp and hair. Now, PRP for hair loss is a relatively new hair loss treatment. So long-term benefits for hair loss are not known yet, and each session averages about $1,000 and can be done every 3 months. Hey guys, thanks for watching. Make sure to subscribe and like my videos. If you have any questions, feel free to leave me some comments. Make sure to check out my other videos on my hair transplant journey and hair transplant tips. Thanks for watching, guys.